Good afternoon and welcome to the daily briefing at the St. Clair County EMA, where Sam Bierman from the Health Department is here once again with more numbers.
Yes, and as we have done the past couple of days, our numbers are really looking good again today. So as of today, 84,851 St. Clair County residents have been tested, which is an increase of 1,457 from yesterday. We are at 7,219 positive test results, which is an increase of 66 from yesterday. And that does include both males and females from under the age of 10 to their 90s. Our daily county positivity rate for St. Clair County today is 4.5%. And we are at 77,632 negative test results. Unfortunately, we are announcing an additional death today, which does bring our total to 188. And that was a female in her 90s with unknown health conditions. And as always, our sympathies go out to her family. For those who have completed the IDPH required 10-day isolation period, we are at 6,562. And for state totals, 5,363,471 have been tested, with 283,885 positive test results, which is an increase of 2,514 from yesterday. And for deaths, the state is reporting 8,563, which is an increase of 25 from yesterday. For hospitalization numbers in St. Clair County, currently we have 50 individuals that are admitted due to COVID-related reasons, and 7 of them are on ventilators. For our regional hospitalization numbers, we have 78 individuals that are admitted due to COVID-related reasons, and 10 of them are currently on ventilators. For our congregate living facilities that are in outbreak status, and that is staff or residents having 2 or more that are either COVID positive or who have COVID-like symptoms, and we will only announce any facilities that have had any changes. Brea of Belleville has 70 cases and 8 deaths, which is an increase of 1 case. And the Esquilin Dammert Center at the Shrine has 32 cases and 2 deaths, which is an increase of 7 cases and 1 death. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. We'll move into the zip code report. In 62059, we go up 1 today to 15. 62201 goes up 5 to 241. 62203 goes up 1 to 205. 62205 goes up 2 to 204. 62206 goes up 5 to 439. 62207 goes up 1 to 247. 62220 goes up 3 today to 574. 62221 goes up 7 to 678. 62223 goes up 8 to 427. 62226 goes up 8 to 742. And 62239 goes up 7 to 111. 62254 goes up 7 to 267. 62258 goes up 1 to 191. 62260 goes up 1 to 145. 62264 goes up 3 to 103. 62269 goes up 2 to 559. And 62285 goes up 1 today to 112. Our daily county positivity today at 4.5%, another good number for Team St. Clair. And our 7-day rolling number today is 4.9%. So that now puts us at 9 days in St. Clair County under 6.5%, according to our numbers, the numbers we put together here every day, the ones that we know are the most accurate numbers that are available. And it's important to note that our rolling average actually has been under 8% for this entire month. So we're pretty proud because we remember what our numbers were. As all members of Team St. Clair remember that we were teetering close to 20% at one time. So getting below 8 is a big deal for us. Let's look at the state's numbers today. They have our regional positivity at 7.1%. That's the same as it was yesterday. And the numbers today, they show Bond County at 8.4%, Clinton County at 17.4%, Madison County comes in at 4.4% today, Monroe County at 9.6%, Randolph County at 6.9%, St. Clair County, they peg at 5.5%, and Washington County comes in at 3.2%. So a lot of the surrounding counties seem to be getting better numbers. Clinton is still up there at 17.4, so we got a little work to do with our friends in Clinton.
Well, hopefully the last couple of days we put that out there, and it seems like they're all pushing forward like Team St. Clair has been doing, and we really appreciate all that help. I wanted to have Brian on just a little bit this afternoon, the Assistant Director here at EMA. A couple of questions on here about the Wednesday you're going to count the negatives as only positive. So there's still that rumors out there that these numbers aren't accurate. I got a business owner from Millstat last night sent us an article that's circulating all over the social media now. So, I want the people to understand, and we've told them this before, the health department and the EMA are sitting here every day, sometimes daily, hourly, into the wee hours of the night and early mornings, crunching these numbers. So I'd like for Brian and Sam and you to explain to our Team St. Clair members and to those who think that these numbers are just being pulled out of the air, how these numbers are coming about, if we could do that.
Sure. So when the health department receives test results, we receive them a couple different ways. We could receive them via fax. Some reports are automatically generated that are emailed to us, and we get some reports from doctors' offices that are emailed reports to us. And then what we do is we take all of those results and we use the state system, which is called INEDS. And we take all of those. We get a lot of our reports from our long-term care facilities because we do call them every day. We make sure that we aren't double counting any results because it's important to us to have the most accurate numbers possible. And we put them into a master spreadsheet. So we have been counting the negatives from every facility that we have known that is testing from the beginning. It's important to note that we do still find some doctors' offices that we weren't aware were testing. And when we find those, we speak to the office, we let them know the importance of getting those results to us. And we've had no roadblocks that have come up once we explain to them the importance of getting us those results.
And Sam, as you go through that, and you announce this every day, in St. Clair County, we've announced 77,632 negative results. Mm-hmm. Had the negative results not been included, our positivity rate would be 100%. Mm-hmm. If you're so to say negative results are not being included is highly inaccurate. Mm-hmm. And we've been talking about this for weeks and probably more than a month now of saying, we make sure these numbers are checked every day.
Yes.
There's a staff that calls places to make sure there's not numbers out there that we're missing.
Exactly. And we found that, that was an important step to do. Some people ask, well, why do you need to call the long-term care facilities every day? Well, because these numbers that we put out, we take pride in the fact that we put the most accurate and complete numbers out for Team St. Clair and for the county as a whole. And those long-term care facilities, they're busy. Some of them are understaffed. Some of them, their patients are very sick. So sometimes the last thing on their mind is picking up the phone to call us. So we said, you know what? We'll kind of take the burden off of them, and we'll be that reminder every day to call and say, hey, it's us. We're just checking in. Have you had any new test results? Have you had any deaths at your facility? And then that way we can keep an accurate count, because we do have 47 long-term care and congregate living facilities in St. Clair County, which is quite a few when you look at staff and residents at those facilities.
And so you've got a process that has evolved over 196 days.
Oh, absolutely.
So there was a time when if we did 15 tests a week,
that was a big deal.
That was a big deal.
Yeah.
We were actually fighting, or at least groups were fighting over who had 10 tests at their lab that they could use, and they were holding on to them. Mm-hmm. So it was during that time that you were able to develop a process of gathering numbers. Mm-hmm. Now that we have 1,457 tests coming in today, you have the system there. So you have the list of people to call, and that may evolve. There may be a new person or a new group that you're finding might not have been included. But as far as we're concerned, and as far as we can see, we have the most accurate set of numbers in St. Clair County. That's what we're going in real-time numbers. So the number that we talked about today was generated right here about an hour ago in this office. All the totals were put in, the spreadsheets were put together. So when people hear this at 3:30, you know that it was just in the past hour that all these numbers were put together. But you've been working, and the health department has been working, all day on these, and probably last night.
And I know sometimes it's hard for people to visualize when we say, we have all these results, like, we are, as Brian said, 77,632. When we get those auto-generated reports that I'm talking about, we get a report from BJC. So all of the St. Clair County residents that were tested at a BJC facility, we get those results. Anyone that was tested at Walgreens in Cahokia that lives in St. Clair County, we get all those results. So it's a generated report that, they have testing throughout the county. So when we say, we get faxes, I don't want people to think that we receive 10,000 faxes a day. We get generated reports that have hundreds of results on them for each facility.
And the reason we say these are the most accurate numbers, and the reason we report St. Clair County numbers separate, is because we don't receive the numbers for Bond, Clinton,
No.
Madison, Monroe, Randolph, or Washington counties.
No.
Those health departments get those numbers, and how they're dealing with those numbers is, what they're doing. But as far as St. Clair County numbers, we know we've got names, addresses associated with every negative and every positive, and the positives are being followed up with. And so this operation here, I really credit the health department. Brian works hard every day with Herb. They got their desks right across from each other, and they're working on these numbers, making sure they're as accurate as is humanly possible.
And right before we send over the numbers to Brian each day, we can say that we go through every one of those results to say that, yes, these are correct and these are the most accurate and up-to-date. So we stand behind our work, and, we take a lot of pride in providing accurate and complete numbers.
Well, I think that's why I called you last night when I got the call from the business owner showing me the article that was out there. And that was taken off of a Sunday afternoon question and answer session we had here earlier this month when the director Holt was here and explained basically what we're explaining now. But they only took a little clip of that saying that, there was some missing numbers out there. Well, if they'd have played the whole thing, they'd have heard the whole question and answer session that day. And I frankly take offense to when people are out there. We are in a pandemic. I don't care what they say. I say it every day. You can believe what you want to believe. We're believing the numbers that we get here every day from the health department. And as the chairman said, I wish we were getting all the numbers from these other counties, because then guess what? We would even have a better handle on what they're doing. But right now, we're concerned about St. Clair County. There's a comment on here now from Mike that says, I trust your numbers and your explanation. It's the state. I wish I could give him answers to that. I don't have that.
But I think what's important to note on there is, if our health department has found a facility that maybe wasn't doing that electronic reporting, is having to be manually counted, they've communicated that to IDPH so that facility can
Yes.
be included in those numbers.
Right. So, I mean,
And we are sharing these numbers with the state.
every day.
But, so you look at that particular Facebook post that had an article, I don't know who the source was, but the reason we have been sitting here for practically 196 days, we said from the beginning, so that St. Clair County residents have a source that they can rely on. They're people that they know, and that's why we continue to try to provide the most accurate, best information you can get. It's not being filtered through anyone. It's right here. We're laying out the raw data. It's all available. We post it so that people can check it and double check it. And much of Team St. Clair does that. And the good news is that when Team St. Clair hears something going on, this is the first place that they go to contact, or if they have a question. And that's really what we wanted to happen. And I'm pretty proud of you guys, because you've made it happen.
Well, and that's what the Emergency Operations Center has been open for. And I don't think there's been any type of other disaster, whether it be flooding, winter storms or what. The EOC has been open for 196 days. So, and we're not.
If there was a winter storm that long, we'd be
We'd be in trouble. But we're not proud of that because, it's when the Emergency Operations Center doesn't have to be open, then guess what? We're all having good days. And so we don't pride ourselves in doing that, but we are here. We are going to do it because that's the commitment that we've made because we're all in this together. Like we say all the time, this is about all of us, all Team St. Clair. And all I'm asking is for those of you who are questioning all of this, it's okay. But before you go out there and start saying that they're false numbers, they're fake numbers, get to the source. Call us and we'll tell you, just like we're doing now. We'll explain to you how we arrive at those numbers, just as we done here in the last 10 minutes, explaining that to you. And we will tell you there's nobody wants out of this more than us, believe me. And we say that each and every day. If you look around our bordering counties, our bordering states, the governor in Missouri, unfortunately, has been diagnosed with it. Him and his wife. We are the ones here saying, wear your mask, wash your hands, watch social distancing. It's everywhere. There's nobody that's going to escape this if you don't take the precautions. And what just boggles my mind is it's simple. Wearing the mask. Washing your hands, something you should have been doing since you were old enough to quit sucking your thumb or whatever you did. I'm just saying, follow the 3 W's. And we're going to get out of this. If you look, the mitigation that's been put in place, if you look at our numbers, as the chairman said, where we were and where we are now, the mitigation has worked. And it will continue to work until we get down. Hopefully, tomorrow we're going to have better numbers, and we're going to get there, and we're going to get there together. Sam's the cheerleader. Believe me, she's going to walk in here that day and say, guess what, we're there.
And St. Clair County is the leader in our region, the one that's pulling the numbers down.
Yeah.
And we want to continue to do that because we can only rely on ourselves. Team St. Clair, it's all us. We gotta count on ourselves.
We're getting quite a few questions today on there too about what does it take for mitigations to be lifted. And right now, the letter of what's written is 3 consecutive days with a 7-day rolling average at 6.5 or below for the entire region. So that regional positivity that today is 7.1 has to be 3 consecutive days at 6.5 or below.
And we've been below 6.5 or below for 9 days. And so I think we're the ones that are pulling that rope. We're pulling Region 4 below 6.5, and we're hoping that we can get there pretty quick.
And if you remember, when those new mitigations come out, it was 6.5 consecutive for 14 days.
It was 14 days.
And that's been reduced now to 3 days, which we're happy about that.
And St. Clair County got pulled off the warning list today.
We're not on that warning list
So
today.
we are.
There's still some of the counties that are in our region that are on there, but St. Clair County was removed from that state warning list.
So the state is acknowledging all the work of Team St. Clair.
They do. They are. So we appreciate it. Didn't mean to take up all your time today, but I wanted to answer these questions on here because we really are thankful for Team St. Clair and for all of you who are maybe just started joining these briefings. Had questions, we'll answer them. And we want to take a few moments today to kind of clarify that. We'll be back with Cindy and Daisy in a few minutes to translate this into our Spanish communities. And then we'll be back here tomorrow. Again, more numbers, better numbers. Thank you.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on,